WHO has been working on the Mpox outbreak in Africa and raising the alarm that this is something...
Hello everyone, welcome back to the channel. Today we are going to talk about monkeypox or Mpox, an infectious disease that's been around for decades but has recently become a major global health concern. In this video, we'll dive into the history of monkeypox, how it spread to humans, and what's happening in the world right now as health officials race to control the recent outbreak. First things first, what exactly is monkeypox? Monkeypox is a viral disease that belongs to the same family of viruses as smallpox, the orthopox virus family. However, monkeypox or Mpox is generally less severe and less contagious compared to smallpox. It was first discovered in 1958 in laboratory monkeys and hence the name. But, fun fact, the primary carriers of the virus in the wild are actually rodents, not monkeys. The first case was recorded in 1970 in the Democratic Republic of Congo, DRC. Since then, Mpox has become endemic in several African countries, meaning it regularly occurs there. For most of its history, Mpox has been confined to parts of Central and West Africa. Periodic outbreaks occurred over the decades, but they were generally small and were contained quickly. However, the virus did make headlines when cases were reported outside of Africa. In 2003, for instance, there was an outbreak in the United States. It was linked to pet prairie dogs that had been housed near imported animals from Ghana. This was the first time monkeypox had been detected outside of Africa, but the outbreak was contained with no fatalities reported. Fast forward to 2022 and suddenly Mpox was making headlines again. But this time it was not just in Africa. Cases were reported across Europe, North America, South America, Asia and Australia. Unlike previous outbreaks, this one seemed to have started with community transmission outside of Africa, which was unusual. Experts believed that the virus spread through close contacts at large events and gatherings in different parts of the world. By mid-2022, Mpox was declared a public health emergency of international concern by the WHO. So what's happening in 2024? On 14th August 2024, the World Health Organization (WHO) declared Mpox a public health emergency of international concern due to its increasing spread in Africa and with potential to spread across countries in Africa and possibly outside the continent. Hours later, Sweden declared its first case of Mpox outside the African continent. The person became infected during a stay in an area of Africa which is currently facing a major outbreak of Mpox clade 1, Swedish health agency said. Since then, Pakistan has also reported one case on Friday, the 16th of August. This traveler was returning from Dubai. The emergence last year and rapid spread of a new virus in DRC, clade 1b, is one of the main reasons for the increased concern at this time. There are two types of monkeypox virus, clade 1 and clade 2. Clade 1 causes more severe illness and deaths. Clade 2 is the type that caused the global outbreak in 2022. Infections from clade 2 Mpox are generally less severe. Historically, clade 1 Mpox virus has been reported only in 5 Central African countries. However, recent cases in additional countries with Central and East Africa mark the first known expansion of its geographical range, heightening the risk of spread beyond the region. This also suggests that the virus is mutating and adapting itself to ensure easier transmission in humans. So what are the symptoms of monkeypox and how is it transmitted? The disease usually begins with flu-like symptoms, fever, headaches, muscle aches and fatigue before a rash develops. The rash eventually forms into a pus-filled lesion that can be quite painful. Monkeypox spreads primarily through close physical contact. This includes direct contact with lesions, body fluids, and even respiratory droplets from prolonged face-to-face interaction. It can also spread through contaminated materials like bedding and clothing. It is also a sexually transmitted disease. Mpox is diagnosed using real-time PCR tests. According to CDC, currently there is no treatment approved specifically for Mpox virus infections. For most patients with Mpox who have intact immune system, and don't have a skin disease, supportive care and pain control will help them recover without medical treatment. Patients who are severely immunocompromised or have certain skin conditions like eczema are at particular risk of uncontrolled viral spread, which is a severe manifestation of Mpox that can be life-threatening. So how is the world responding to this outbreak? Vaccination is a key strategy. According to CDC, 2 vaccines may be used for prevention of Mpox. The first one is the Jynneos vaccine, which is approved and recommended by CDC and ACIP for the prevention of Mpox and smallpox. Second is the ACAM 2000 vaccine, which is approved for immunization against smallpox and could be made available for use against Mpox. The Jynneos vaccine, currently the only Mpox vaccine approved by the US FDA and the European Medicines Agency, is manufactured by the Danish Bavarian Nordic. In a statement, the vaccine manufacturer's CEO said that Bavarian Nordic can provide 10 million doses of the Mpox vaccine to African countries by the end of 2025 to help them deal with the latest global public health emergency. The company said it was waiting to receive orders. The WHO and other health organizations are working on long-term strategies, not just to control the current outbreak, but to prevent future ones. Increased global awareness, better access to vaccines, and education on reducing transmission risks are all part of the plan. What should be your action plan? Firstly, keep yourself updated with the latest developments in this health emergency. Secondly, avoid contact with people who are at a high risk of this disease or have this disease. For example, people who may have traveled to endemic areas recently. Monkeypox might not be a new disease, but this global outbreak has shown us how quickly viruses can spread in our interconnected world. While the situation is if you want to stay informed about the latest health news, be sure to hit that subscribe button and turn on notifications. If you liked the video, please comment and subscribe to the channel. See you in the next one.